I'm going to shift now. We'll talk about gambling, sports betting, and medical marijuana. And that's one of the questions that's come to us from Eric Crawford, who has been a valiant advocate for this effort for many years in Frankfort. He asked, how do the new members feel about medical cannabis, House Bill 136 and Senate Bill 92? And I'll go to Senator Storm and ask you, perhaps you don't have to have great familiarity with the details of those bills, but on the premise of what they are proposing. How do you feel about legalizing medicinal marijuana in Kentucky?
Well, I think the first thing is, I think President Stivers mentioned this a few weeks ago. Right now, if I'm not mistaken, it's still considered a Schedule I controlled substance by the federal government. So until that issue can be resolved by the federal government, I don't know that the Kentucky legislature should really take a step into that area. That's just my personal opinion. Should
just wait till the Feds act first and then come behind and do what perhaps constituents are saying. There does seem to be an overwhelming amount of Kentuckians who support that. I don't remember recent polls, but it seems to be a plurality majority who believe that the time has now come. Do you hear that from constituents in your district, that they are concerned about this issue and know folks who would benefit medicinally from the use of medical marijuana?
I have heard from people that say those things, but I also know that I practice in federal court on a daily basis, and I see a lot of cases, in fact today, where a gentleman was sent back to prison for marijuana. Mm-hmm. Again, I think it's a problem with the issue being a federally regulated controlled substance right now.
Do you view it as perhaps even a gateway drug, aside from the legal entanglements of it at this current state? Do you have any opposition based on others who have said that this is a gateway to other more harmful, abusive, addictive drugs?
I don't know that I have any personal views on that at this time. I know that I've seen a lot of clients that have went to prison over that issue, but mm-hmm. Again, I've heard from other people that say that they've had seizure issues or epileptic issues that could potentially be treated by medical marijuana. So again, I think the bigger issue is whether or not the federal government regulates it or deregulates it.
And to your earlier point, there have been some legislators on the other side of the aisle who said, you know, if we get to the point where Kentucky does do this, then you have to concern yourself with the sentencing of marijuana, excuse me, that even that needs to be taken as the next step to decriminalize marijuana at that particular state. Do you have any comment on that action?
Well, I think not necessarily. I don't. I think the bigger issue again goes back to whether or not the federal government continues to regulate this as a controlled substance or not. I think that's really the pinnacle issue.
Senator Berg, I'll come to you as a physician. I don't know if you can speak to this from clinical perspective or not about the medicinal purposes of marijuana being used in this way as a therapeutic. Do you believe in some of the studies that say that it has therapeutic benefits, or have you also engaged yourself in learning about the other psychotropic effects that it could have and other, harmful effects to the brain development of youth, et cetera? Where do you fall out on this issue?
This is a very interesting issue. First of all, Senator Storm, I would like to remind you and let our viewers know that the reason marijuana is a Schedule I drug is actually a shame on our history. These were intentionally racist laws that were made to, I don't know what the word is. The history of these laws is shameful for our country. And I know of many, many constituents who want us to legalize medicinal marijuana in this state. I personally am in favor of that. We know that it is helpful for a subset of epilepsy. A number of people with chronic pain find it extremely helpful, and particularly helpful in people in recovery. People who are either alcoholics or opioid addicts will say unequivocally that it helps them to not feel like they have to use. We are growing marijuana, we are buying marijuana, and we are selling marijuana in this state, probably number 1 or number 2 in the country. But what we're not doing is allowing our citizens who feel like they need to have access to it, nor are we gaining any revenue off of this product. which many, many other states already are.
So I want to,
the history of marijuana.
yeah, I do want to ask you right
Go
there,
on.
just a couple of things, Senator Berg. Let me ask you first about taxing marijuana. Do you support that if medical marijuana is legalized in Kentucky? Do you support it being a revenue-generating measure? And do you have figures that would show how much it would actually raise and put into the state coffers?
We actually don't tax medicines in the state of Kentucky. So if we passed medicinal marijuana, that would not be a revenue stream for the state. We would have to legalize recreational marijuana, and then that could be a major revenue stream for the state. Not only is it a huge revenue stream, but it also, once you legalize it, it actually makes it much more difficult for minor children to get a hold of this. Because right now, everything is on a black market, and that market is thriving. We are, like I say, we're growing it, we're using it, and we're selling it. There is a huge market for this drug. And so many other states have already done this. I would honestly like to see Kentucky not lag behind other states. I would like to see us up front, moving forward, being progressive, using this money specifically, earmarking it for our teachers' retirement program, and let's move on.
Let me ask you, Senator Berg, while I have you right here, you mentioned a moment ago about possibly this being a diversion drug, perhaps, that would maybe even reduce the opioid addiction dilemma and plight that this state has. Explain to us your rationale there, when there have been so many studies and others who have proclaimed that it would, in essence, would be a gateway drug and even make that exacerbate the drug addiction issue in this state. Which one is it?
One of the things you have to understand about marijuana, because it's been a Scheduled I drug, we have been precluded in this country from doing adequate medical research on the safety, the efficacy, the dosing. None of that research has been done in the United States. There is research from other countries. And one of the things that it does help is people in recovery show less propensity for relapse with medicinal marijuana. And to me, when we have this tremendous opioid crisis going on, this is something simple that even honestly, if it's a placebo, it works. And the harm that we've seen so far and what the real studies from other countries have shown is that it is so much safer than alcohol, unequivocally so much safer. There is not a single death attributable to marijuana overdose. It doesn't happen.
Okay, I want to go to Representative.
When we compare it to the subject.
Yeah, let me go to Representative Decker and ask her, because I think I understand from your background, Representative Decker, that you've worked with folks in transitional housing who may have even dealt with drug addiction issues, homelessness, other things. Can you talk to us about that and how you view this medical marijuana proposition that are on the table?
Well, first and foremost, I don't have, I don't know how I would vote on it. I haven't heard the testimony. I would benefit greatly from that. I do have concerns, many of which were addressed just now, that lead me to even further question it by what Senator Berg said. First and foremost, I think, from what I understand, and I haven't heard the testimony, there have not been adequate medical studies. That's what the senator just said, to know proper dosing, etc. I even had a physician friend of mine tell me that he believes under the Hippocratic Oath he could not prescribe it because he did not know if it would do harm. So that point is very troubling to me. Secondly, I think the discussion quickly turned to the need to legalize marijuana. I think this is the overall goal of this bill. I think it is a slippery slope, and that it's kind of a gateway to that. I think another concern I have is that all of the medical benefits that I've heard talked about are already available in CBD oil, which is legal in Kentucky. I have a friend whose son had severe epilepsy, and it has stopped with the use of CBD oil. I have a friend who's been through 13 surgeries without any pain medication. He was fearful of addiction. He has used CBD oil, and this is major, major surgery. So I'm not clear why we need medical marijuana when we have the same properties in an already legal drug. So for those reasons, I'm concerned, but I would very much like to hear the testimony.
Right. And we'll see if that comes to fruition. Representative Stevenson, the question...
You did
ask, go ahead.
You did ask one other question, and that was my experience. I do operate, I'm an executive director of a charity, and we do have homeless women and children's shelters. We mostly deal with abused women, and in fact, we take no people who are addicted to drugs because we have children and we have to protect our children. But we do take women if they have been through a program and are 1 year clean. And I will tell you that it is very hard to find women who can kick the habit of marijuana. They struggle in their life for many other reasons, and they go back to marijuana. And we can't have them in our shelter if they're doing that because of the children. But it does not seem to me to be something, and that then stops them from being employable because of the drug test at employment. So I don't see it as a good thing to help people become self-sufficient. In fact, it works to the opposite for them. So I have seen from personal experience that hinder people from becoming self-reliant.
Mm-hmm. Representative Stevenson, the same question to you. And as Representative Decker just pointed out, there are similar properties available, therapeutic in CBD oil. So perhaps that's already legal. That's already available. That should be, in her view and others, Senator Storm, perhaps good enough for right now.
If it works for you. We all know that medicines have work differently in different bodies. And I would submit that there are a lot of drugs that are Schedule I drugs. And this is one of the areas where we have to be really careful with medical marijuana, that the government is interfering with a relationship between doctor and patient. If the doctor has enough studies, if he's done the research, and we know that this marijuana will benefit a patient, then why is it any different than any of the other drugs on Schedule I? It's not. We need to get out of the business of telling doctors how to advise their patients. And we need to provide them the information they need to make the difference they want to make with their patients.
So
I would like to just jump in and add real quickly, even though these studies haven't been done in the United States of America, they have been done in other countries. Israel, in particular, has done a tremendous amount of work on this drug. It is not the danger that people think it is. And for a lot of people, it makes a difference.
So we know that there's been discussion about this, and a bill had moved forward on the House last year. And this question, Senator Storm, comes in from Tim Cantwell of Rhineville, says, he asks, how can we convince Senator Stivers to allow a hearing on SB 92, medical marijuana, in the Senate during the 21 session? You have any advice you would lend to Mr. Cantwell about that? And do you think that there's a temperature in the caucus, and I know you're not speaking for Senate President Robert Stivers, to actually hear this bill, hear the testimony, as Representative Decker said she would like to even hear? Perhaps it may not change her mind, but just to be grounded in the discussion and the testimony for and against it.
Well, I'm not going to speak for President Stivers. Obviously, I want him to speak for himself. But I did want to mention one thing, or go back to the question. The question was asked about medical marijuana, and then it quickly phased into, as Representative Decker pointed out, legalizing marijuana, and then the comment was made that there was a huge black market. So again, those are concerns. Mm-hmm. If it's a Schedule I because of the federal government, then that's an issue for me.
Right. And do you see it as something that could quickly accelerate to then the full-out legalization of recreational marijuana? Because we know that there are already movements in the state to make that happen alongside the medical marijuana proposals.
I think so, because, you know, again, we had this conversation, we've been going on for a few minutes now, and it went initially from medical marijuana into legalization and the black market and huge revenue streams. So those were my concerns.